Yes, ma'am. So the first question naturally is, what made you transition from dentistry to management? So, did you have an influence? Did you have a mentor? What was your source of, inspiration when you made this
Hmm.
transition?
So, to be honest, the decision was not easy at all. I mean, there was many second guesses. Is this the right way? Because all my friends were either giving their NPDs or they were planning for their post graduation, MDS, or they were getting into practice. And while I also got into practice, I practiced for about a year, a little more than a year. But there was always this feeling of doing something more, doing something different, maybe, I don't know. And there was always when I was practicing, at least I felt that the gaps in our education were mainly uh, uh, business related. We never really got a business orientation in our dental training, and as dentists we are also businessmen. So
Right.
because it's also about running the clinic, it's not just about,
Hmm.
and of course the most important part, the 80% part of it is treating patients, but there's also a business angle to it. And I feel that that's something that we should have been taught, because a lot of the people just finish their BDS and then they start practicing. They don't
Right.
think of a post graduation.
Mhm.
So I felt that was a gap, and I was also very fascinated by some of the doctors, senior doctors I knew at home, who were now, who were at that time healthcare administrators for large hospitals, large chains, and they also always sort of encouraged me to think of MBA more from a perspective of getting into healthcare administration. And
Okay.
that's, I think, how, and of course, a big factor of that was that I had done math till 12th, so there was also this comfort with mathematics. And cat does have a lot of mathematics, basic mathematics, in its curriculum.
One
So
question, yeah.
combination of those factors, made me just nudged me towards taking cat while I was practicing. And I never really expected to do really well or to get into IIM. Those were, I never, that never even entered my mind, because I was not even expecting it. So,
Right.
but I guess plans, sometimes it's just plans. So that's how it
Hmm.
happened.
Right. So, ma'am, when you were talking, I was thinking about how much I can relate to it. And the other people that I speak to, who are also inclined towards management, we all have the same, same thinking pattern, that we all think about how we're never taught about management while we're in dental school
Yeah,
and how important it is. So I think
yeah,
now we can say that it's almost like an established fact that we
yeah,
should be taught, about practice
yeah,
management. It should be one of the crucial things. So,
yeah. And
ma'am,
I think
go
now
ahead, ma'am.
even technology, just using technology more and more in your practice,
Right.
that is also, while I'm not day to day involved now with dentistry and I don't know how it's evolved, but I think that that is also something that is equally important at a graduate BDS level.
Right. Definitely, ma'am. So, ma'am, you spoke about how you were practicing and you studied for CAT at the same time. I can't imagine how you did that. So, ma'am, can you just tell us a little bit about what your preparation was like?
So I chose for classes in the morning, because the dentist I was working with was practicing in the evenings. So
Okay.
she wanted me in the clinic in the evening, because in the morning she preferred to, she was practicing in a hospital, so she used to go
Hmm.
there in the morning. So which is why mornings was free for me. And
Hmm.
I've always been an early riser. So what I used to do is practice in the morning, then go for my classes, and then go directly to the clinic. So that's the sort
Okay.
of routine I had managed. And anyway, you are just you you just want to keep doing more. So it was a very good thing for me that I was really busy, because otherwise
Right.
I would have driven my parents crazy. I was living with my parents at that time.
Right, right. Yeah, that actually, so even I'm living with my parents and I can understand what you mean. They're glad that I stay busy.
Yeah.
Yes. So, ma'am, what did it feel like, getting into IIM and coming from dentistry. So I know that you said that you had math in the 12th grade. So did I, but I still find the CAT questions difficult because there's so much of estimation involved. So how
Yeah.
did you, manage to do that?
Practice. What I realized early on, after a few tests, was that you just need speed. I realized speed is the most important thing in giving cat,
Yeah.
and along with speed, deciding which question to attempt and which question not to attempt. Because at
Right.
that time, I don't know if it's still there, but at that time there was negative marking also. So
Still
it's
remember.
better to sometimes leave a question and come back to it rather than go
Attempting it.
sequence wise
Right.
sequentially and attempt it and get it
Mhm.
wrong. So those, I think, those with those two learnings, it was about practice. After that, just practicing the speed, practicing the decision making, and going back and evaluating. So I think that's what worked for me. I was practicing almost 2 hours, 3 hours dedicatedly by myself. This is beyond the classes. So
Right, right. So I think it's only when you put in a consistent effort that, you can achieve something like cracking the IIMs.
I feel there's luck also because on that
Mhm.
day what questions you get, it's so
True,
dependent
true.
on those things. So but from your side, the best you can do is give it your best, which is by practicing. So
and
Right.
and I
leave
think
no
to
stone
add to
unturned.
Mhm.
and I think to add to that, I think it's very important that you focus on all the areas. Like I find that some people are very much focused on quant, some are very much focused on like the English reasoning and those aspects. But I think all the aspects need to be covered equally, because like all
Yeah,
the aspects are equally important. So I feel that some people who
absolutely.
are from engineering background, they are very strong in mathematics or the quant area, but they lack in the other space. So I
Mhm.
think I think Mrinalini ma'am was able to do that very effectively. Like she was able to do manage all the aspects, which are all the
Mhm.
areas which are there in CAT, like the quant, the reasoning, everything very effectively. Otherwise, getting into IIM Lucknow is not possible.
So, ma'am,
It's
what did
luck.
it, yeah. Ma'am, but even then, I think it's great. I mean, congratulations for achieving that. Yes, ma'am.
Thank you.
So, wanted to know what was your experience like to be in a class where there might not have been other healthcare professionals. Did you have any batchmates who were from the medical background?
We did, yes, yes. I had, we were, in fact, all of us banded together because we were of a similar background, and we
Right.
were six doctors in my batch, including me.
Oh,
Oh,
that's
Yeah,
good to
wow.
know.
six doctors in my batch, including me, and we were very happy to find each other there because because we were not from an engineering background.
Right.
IIM Lucknow wanted us to join 2 weeks earlier because so that they could cover some basic concepts with us. And that's when we all met and we were really happy and we stayed most of us have stayed in touch. We are still in touch
Mhm.
and over WhatsApp. So yeah, it was. But yes, six doctors in a batch size of more than 400 is hardly any number. And and all everybody comes from an engineering background or a commerce background.
Right.
And the biggest thing that surprised me over there is that as dentists we never worry about having getting a job. It's hardly ever crosses our mind कि भाई रोजी रोटी कमा पाएंगे या नहीं. But in MBA, it's all about getting a job, and CV making was, I think, the most painful time of my life because I had never even thought of making a CV before that, and there were nights spent on making the CV. So yeah, it was a huge culture change in that way. I think in dentistry or in medicine, we are much more grounded and closer to uh, you know how shall I put it? It's we're just trained differently to think differently, and
Right.
it's not about getting a job, but it's about how well we can do the job. That's how we think
Mhm. Mhm.
as dentists. So that was the
Understood, ma'am. Yeah.
difference.
And ma'am,
Like,
I just wanted to ask, yeah,
yes,
one
yes,
more
go
thing.
ahead,
So
please.
like, yeah, sorry. So, like, what are the challenges that you actually faced when you joined IIM Lucknow? Because if I can say from my experience, when I joined my MBA college, so like most of the 80% of the folks are from engineering or BCom background. So I wasn't that good with Excel because I had never worked on Excel before. So and similar kind of challenges like people who are from healthcare background they were facing at all. So what kind of challenges you faced when you joined IIM Lucknow and where you felt that the other peoples are ahead of me because of that particular background or because they have already worked on this kind of thing, but I need to actually like force myself or push myself in order to get to the speed and everything.
So academically, I think economics was a tough subject for me,
Mm-hmm.
and yeah, that took some effort. But I was very sure that I have to get into healthcare management. And within 2 months of reaching IIM Lucknow, I realized that भाई यहाँ तो कोई healthcare management company नहीं आती, अपोलो नहीं आता, फोर्टिस नहीं आता, नारायणा नहीं आता, कुछ नहीं आता था. You know, it was all McKinsey, BCG, and HUL and the likes. So I was like, okay, now anyway we need to find a job by ourselves. Clearly, it's evident because till then I was still thinking of healthcare management. So I was, I was more concerned about just doing well overall, which includes learning more rather than getting the marks. And I didn't have the best marks, but it was fine. I mean, it was an okay experience academically. I think dentistry was much more better academically than MBA. But what really fascinated me was the summers process, and I was very lucky in that manner that the Tata Group came and they presented about Tata Administrative Services and just the legacy and the vision of the Tata Group in terms of serving society. And to us, from a medical background, that really resounds because finally we are about treating people, making them feel better. So that really resounds, that purpose of serving society. And they selected me for the summers process, and academically I was doing all right. So and then I got a PPO. So second year was completely chilled out
Ah.
because I got the PPO. And second year I also played to my strengths and took subjects which were more to my liking. So
Mm-hmm.
80% of the subjects I took were more to what my strengths were, and then 20% of the subjects were what I found challenging because I didn't want to lose touch with I didn't want to have it all easy because then that makes you complacent and you feel okay, fine, we're
Right.
fine. But the reality is that you're not good at 100% of the things, and sometimes that 20% keeps reminding you and keeps you humble ki bhai,
Mm.
there's something you don't know and you should work on it. So that was
Wow,
that
I
was my
love that
approach.
mindset. That's really that's really inspiring, to opt for things that are challenging so that you stay humble. That's awesome.
Pallavi, you wanted to ask something? Huh? Sorry, I had to cut
Yes,
in.
yes. Yeah, no, no, no worries. I was just saying that I understand the, you know, thinking pattern that we have in dental school because we don't think about placements at that time because we don't have a placement cell.
Yeah,
But in MBA, that is the
yeah,
goal that you have to get placed at a good
yeah.
company. So I can understand that it must have been a shock for you to, adapt to that kind of a thinking pattern. And now I would have to say that things have changed now. So in dental school, there are students who are working on their CV now. So when they go for the post grad, it's not the first time when they're going through that
Okay.
process of building their profile. Yes. So I just wanted to tell you that people have started focusing on
Okay.
this.
In which case it's great because then it's
Mhm.
less of a surprise and less of a cultural change. And also, I
Right.
feel that today, especially in the digital world, really knowing your strengths when in the lack of face to face communication, because finally we are human beings and we do connect better in person than we do
Definitely.
digitally.
Mhm.
And in that situation where we are connecting digitally, then for somebody else to really uh, get a sense of you before they meet you or before they work with you, it's become even more important now to have that sort of CV,
Right.
to know where what you're good at, to know where you can contribute to companies or to the healthcare setups. So I think it's great. It should come in, and now even have I'm used to it now. So I think that's great
Right.
if we are doing it
Yeah.
early.
Yeah, that's
Yeah.
very important. So actually, the webinar which we had conducted like last month, and more than 75 people joined, and all the aspirants, and I think 70-80% of them were from course Manipal, if I'm not wrong,
Yeah.
Pallavi.
Yeah.
Yeah,
Yes.
so that was one major thing which we had told them, that you have to work on your CV, because it
Yeah.
should not come as a surprise. And then we spoke about all the 5-6 things that they can actually work on, like participate in the competitions, work on all these things and everything, and do summers really well in case if you are not having that kind of experience or anything. So that CV
No,
point,
you
I
guys
think
are
it,
doing a great job here by telling these people and having them ready and prepared. That's
Mhm.
very good and wonderful that you guys are doing, and I hope you guys keep doing it for more and more people,
yeah.
because
Thank
having
you.
that guidance is
Right.
brilliant, and these guys are really lucky to have you guys.
Yeah, and so
I
actually when
think
we started, so we
mhm.
we were not sure that we would be having so much of response or anything, because it's such a niche category. Like still now, like
True.
compared to engineering plus MBA background, BDS plus MBA background is still niche. So, but now we have
Mhm.
250 plus members over there. We have a WhatsApp group of more than 150 people, and everyone is so
Okay.
excited, and everyone is asking us like what we can do and everything. And it is not only about aspirants. They are like 50-60% of the people who are there on the group, they are already working in some multinational organizations.
Oh, okay.
So yeah, so even the networking, I say, would increase or improve a lot, because we all come from a
Yeah.
similar background, and we all would have faced some similar kind of challenges, as in like transitioning
Yes.
from dentistry to management, which would not have been easy for many of us. And so I
Mhm.
think getting everyone on the same platform, getting people like you who have had so much of success, got into top IMs, and then have been working with Tata Group, I think it would serve as a very good guidance for all the people who are actually trying to make that transition.
No, you guys are doing a great job by helping people and being there, because I know from my own experience that I was lucky to have people at B school at IIM who sort of figured out that this girl needs help and they helped me. But this is great that you guys are doing it in a more focused fashion and you can empathize more. So that's always very good.
Right, right, ma'am. So, it's not that difficult to probably get leaders in the industry to, come and speak to these students because they've been through this and they know that it is such a
Yeah.
pain to get in touch with seniors who are in this field. And because I myself, like, I have spoken to people, but I wasn't able to form that, personal connect with them. And then it gets a
Mm.
little demotivating. So, I think, yeah, such platforms are good and they have definitely been benefiting students because I know that some of my batchmates have contacted Dr. Vishal, Dr. Ankit, and there are other juniors, there are people from other colleges as well. So it's not just
Oh,
MCOTs,
so the word
yeah,
is spreading. That's really nice.
yeah,
Yeah, yeah.
yeah. So it's been good
And
so far.
and people
Right.
have been personally reaching out to us. So that is very, very good, which I feel that they are very proactive in the sense now. Like in nowadays, I don't know, 99% of the batch, it was like we have to do MDS, we have to continue with clinics and everything.
Mm.
Now people like that vision is more, I would say they want to explore the world. It's not, they don't want to stick with like,
Right.
if they're interested in dentistry, obviously, but they want to explore more. They want to explore the management side of it. I think that is very important, very, very, very good to actually. Okay, so
Right.
I'm moving on to the next question. So, like, if I'm not wrong, so you have been associated with Tata Group for more than 7 years now,
Yeah.
and I just we just wanted to understand how the journey has been, what have been the learnings, and why have you stuck around with one organization for, because for more than 7 years, because we see with so many people that they tend to change the organization in every 2 to 3 years and they want to switch and everything. So just wanted to understand your entire journey and your decision to stick with Tata for such a long duration.
So as I mentioned earlier, when TAS came, we was really inspired by the Tata Group's history. I never knew so much about the Tata Group before that, and I got the offer and I joined the group. And to be honest, even though I've been with the group for almost 8 years now. But through TAS, you get to uh, be a part of several companies. The first year is all rotation, where I was working for four different companies for 3 month long stints. And even in the first year, a lot of my work was related to healthcare, surprisingly, because there were the Uttarakhand floods, and the Tata Group launched a massive rehabilitation effort, and I was a part of that team. So for 3 months, I was there working on skill development, healthcare initiatives for just ensuring basic healthcare is available to the people of Uttarakhand.
Mm-hmm.
And then then I came to Tata Steel, where I was again working in their community initiatives, of which healthcare again was a big part.
Mm-hmm.
And then my fourth stint was with a group company which was working on healthcare related business ideas. So they were trying to ideate on what Tata Group can do in the healthcare space. So
Mm-hmm.
my first year was, I feel somewhere or the other, I was always able to apply my knowledge. And
Mm-hmm.
maybe it was because they knew that I was from this background, so I happened to get these roles that could also be. And then after that, I joined Tata Trust. So Tata Trust is the philanthropic organization,
Mm-hmm.
sort of a holding company for Tata Sons because they own 66%, about
Okay.
66% of the shares. And Tata Trust is more than 100-year-old philanthropic organization working in healthcare. And again, I was part of their healthcare initiatives, supporting NGOs, grassroots organizations to deliver primary healthcare, as well as working with large institutions like Tata Memorial Hospital, Tata Medical Center on oncology. So across that spectrum, I got to work. I was with Tata Trust for more than 4.5 years, and uh, and I was always using my knowledge as a dentist somewhere or the other, along with my business knowledge. And then I came to Tata AIA Life. So to be honest, when I came to Tata AIA Life Insurance, I knew that insurance is important overall for public policy, because increasingly we are seeing the government's focused on insurance for funding large programs, be it healthcare, be it financial inclusion. So everywhere insurance plays a huge role. Agriculture insurance plays a huge role in public policy. And
Mm-hmm.
4.5 years with Tata Trust, I was very inclined towards public policy, wanted to continue doing that. And I realized that insurance is a space where my knowledge is very limited.
Mm-hmm.
And luckily, Tata AI was looking for somebody to come in. And even when I came to life insurance, though I never used my healthcare experience so much, but today, even life insurance organizations are not just about paying out claims when somebody dies early. Uh, as we are living longer, life insurance also plays a huge role in ensuring that people are living healthier, so that
Mm-hmm.
it makes business sense because I don't have to give a payout. Plus, people are living longer and living healthier. There can be nothing better than that for India. So even here in Tata AIA, we are increasingly focusing on healthcare products, how we can help people live longer, healthier. So again, somewhere that basic knowledge comes into play and helps you at least connect the dots easier than somebody with a non-healthcare background. So I would say that I've never really moved away from healthcare. It may not have been my main sole focus, but it's always been of use to me in the Tata Group.
Yeah, 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 that is true. That is true. And actually, I would say that, like, even like broadly speaking, you have been with Tata Group for 7 years, but still you have worked across so many different organizations within the Tata Group itself, and different kind
Yeah,
of works and projects you have worked on. So I think that is what made your job like more interesting in terms of handling all these different kind of projects and everything what you were just
very
talking
true.
about. So yeah.
Yeah,
And yeah, so a next question to you, ma'am, is like we would want to know a bit about your family, and we would also want to know like how you maintain work-life balance, because in corporate world that is also very important. Like how you, because we have to manage both the things. We have to manage our work, we have to manage our family and everything. So our aspirants or the people who are in the group, we would all want to know that how you manage it so well and everything.
So I have a daughter, 5-year-old daughter, and to be honest, it's tough. Striking a balance is tough, and I've barely managed to strike it. But what I've been, lucky with is that my family has been extremely supportive of the days when I've had to work late, pull night outs. They've been very supportive. I also used to travel a lot. Almost 20 days a month, I was out for almost a year.
Mm-hmm.
So they've been supportive throughout, and that's my parents-in-laws, and my husband, my daughter especially, because otherwise, if she calls you and says I'm missing you, then it's very hard to be where you are.
Right.
So, but she's been very supportive, and on the work front also, my bosses have been very supportive. They've realized, that there are times when I've not been able to attend a meeting or I've needed to take a leave, even though there's something important going on, but they've been very because I think everybody's realized that there are days when family will take precedence because there's something happening in your family where you need to be there, and and family realizes that there are days when work takes precedence because there's something happening at work and you are needed over there. So it's not about balancing time every day, but it's about balancing on an overall yearly basis, ensuring that you balance that out. So that's how I look at balance, because every day doing that may not be possible. At least I've not been able to do it, and I'm happy to get tips on that. So yeah, that's my take on balance.
Ma'am, I read an article which said that more than balancing your time, it's about balancing your energies. So, balancing your energy in
Yeah,
different aspects of life.
yeah. And just to build on that, what you this reminds me. One thing I've realized is that you keep family first, and then you take decisions on where your energy or your time must go. So today if I tell my daughter that, listen, I can't read this book with you because I need to work on a presentation or I need to work on a document, if I'm sure that I'm doing it because it's really critical for my job and my job helps me be a better mother to her, then in a way I am, finally taking care of my family. It may be in a roundabout way,
Yeah.
but finally I am taking care of my family. On the other hand, similarly, if I tell my boss that no, I can't, join this meeting because I need to read a book to my daughter, then that is also taking care of my family.
Right.
So it works both ways.
Right, right. So, I mean, similarly, like you're taking care of, your mental health as well. And if you keep focusing on work, then you might, still have your family at the back of your mind, and you probably won't perform as well as you would if you had the time to take care of your family beforehand. I mean.
Sorry?
uh, I meant to say that when you take a break from work and you're focusing some time on the family sector, then you feel more recharged when you come back to work.
Yes, absolutely, absolutely. And that helps with work as well, because if you're feeling fresh, then the same work which you would do in 3 hours, you'd probably be able to finish in an hour.
Right.
So it works both ways.
Hmm.
That is very good to know, and in fact that is very important. And the point that Pallavi was just talking about, that mental health, keeping your mental health intact and everything, because we have seen that during this COVID times and everything, when people are working from home, so people have to work for like 12-14 hours a day. Even sometimes,
Yeah,
even I have to. And sometimes, like at the end of the day, I'm so like for last 14 hours I have been working, I don't have any time for my family and everything. So sometimes you
yeah,
carry those thoughts when you're sleeping as well. And I think having that balance of doing something in order to keep yourself refreshed and everything, that is very important considering the situation
very
or the times
important.
that we are living in. That's actually very good to know how you are balancing your time between your family and
No, I'm not.
work.
I'm balancing it on a year. Year scale is large now, so you can manage to do it.
Yeah, yeah, yeah. And ma'am, just wanted to ask you like our last question for today's session, and like, what would be your suggestion for all the aspirants who are wanting to who want to make a transition to management, or who are a bit confused about how to go ahead with their careers and how to start their preparation for CAT, and what all opportunities they want to look into? A broad question I'm asking you, but they would want to know like what kind of sessions you want to have for them.
So I'd say that stepping out of the well-trodden path is always a difficult choice to make. And but once that choice is made, uh, we should give it our all. Even if it means failing at first, we should really give it our all before deciding to quit or deciding to again go back to something else. So and giving it your all for me at least is uh, identifying what you're not good at or what's not working for you, and then going and trying to fix that rather than skirting that issue. So once you take it head on and you still are, you feel okay, fine, I don't know why I'm doing this. This is not interesting me. If this is what it takes, then that's fine. I don't want to do this. That's fine. I mean, once you've taken a decision and you've explored it and you've decided that okay, this is not working out, so bad decision. Let's do something else. That's great because then you know that you've tried and but but if you do tackle those issues and you are able to overcome them, then you learned something new and you've also made yourself go forward on that different path that you've chosen for yourself. So I think if that would be my advice, that don't get bogged down by initial challenges. Take them head on and only either you'll win or you'll learn something and you'll do something else. So either way you win. So always take challenges head on.
I think one problem which they face is like they don't have the clarity as such, in terms of like even like if they like some of the people we interacted with, so they were like, I'm still confused whether I should go ahead with MDS or I should do MBA. I'm still confused. So I think like many of the folks, they don't have that clarity
Yeah.
in the sense,
Hmm.
because like for the last 4 or 5 years they have been working on the clinical aspect of dentistry and everything, and suddenly to make that transition, so probably they're not getting that kind of support, or probably something is not clear in their
Hmm.
head. So
So clarity to honestly, matlab, even today, there are times when I think uh, because the flexibility that a dentist life provides you
mm-hmm.
is not something that you get with a corporate life.
Right.
And there's always that trade-off. And I feel that no matter what decision you take, uh,
Mm-hmm.
it's sometimes you just take a decision and do everything to make it right, and that's it because it's a guess. Nobody knows how it's going to turn out, and whether
Absolutely.
it's MDS or MBA, nobody knows how it's going to turn out. And but because you've done dentistry, you are intelligent, you are smart, you are capable, and most importantly you can manage people, which is so important to have human relationship skills. And once you have these ingredients, I think whatever you take up you will be good at. So but once you take it up, you have to give it your 100% and really tackle the challenges, because if you don't tackle the challenges, then somewhere you are doing yourself a disservice because you will not be as successful as you could have been. So
Very true. Yeah.
and it's a guess, MDS versus MBA. My friends who did MDS, they're doing excellent, they're doing great today. uh, some of them also considered doing an MBA, but they chose to be with MDS, and they're doing really well today. And similarly, the people who were with me in IIM, who were doctors, they're also doing really well today. So, it works out in the end. You just have to give it your all.
Absolutely. Absolutely. That is very
Right.
important. Thank you so much for your thoughts, man. Pallavi, you want to ask any more questions? Anything you have in your mind?
No, that's all from my side.
Yeah, I think we have already over an our time. But it was so good to interact with you, ma'am, and like finally we got
I
a
hope
chance.
I've helped.
Definitely, ma'am, definitely. And once we'll be sharing this recording to the entire group and everything, so probably they would also get to know like how your journey has been. They would take inspiration from your journey, and probably we might need your help in sometime in the future as well, in terms of, because we have many things in our mind.
Anytime.
Yeah, like how we want to
No,
go
you
ahead with
guys
the
are doing a great job, and if I can help in any way to help you guys do a better job, happy to do it, because giving guidance to people when they are at a crossroads, that's brilliant. That's absolutely brilliant. Please continue on this, and if I can help in any way, please let me know.
definitely, ma'am. Thank you so much.